as well as a community standpoint. Get to know them, and possibly, 10 years down the line, you can work together and things like that. Okay, so curriculum is not officially announced, but it's like 99.9% that it's going to be the Arizona school. Exactly the same. I talked about the third-year site, and I talked about the fourth-year site. CHCs are important to us. That's what we're going to put our focus into. This is a picture of the CHC that's pretty much done now, that we're going to have in Kirksville. And the first floor is going to be all medical. The second floor is going to be all dental. And so as first and second years, I'm hoping there's going to be some cross-cultural things, and maybe this first and second years can go over and observe some things and see some procedures done and things like that. Keep in mind, CHCs, like I've said, is what we're going to focus on. I think the one thing you want to come out of as a professional, as a dentist, is experience. When you go into your practice, you've had some experience, so you're not green. This will provide you a lot of experience. The people that go to CHCs, they haven't been to the dentist because they can't afford it. So the reason they go is because they can't stay with the pain anymore. So you're going to see a wide range of things. And I was in Arizona, and I was talking to one of the professors, and he told me a story that I thought was really telling about this. He said that they had one of their fourth years, so he was on his rotation. He went to a clinic, and there was the trained dentist who had been there 20 years. There was somebody who had just graduated dental school, and so he was there as well. And the trained dentist asked the guy that had just graduated to perform this procedure, and he said, "I'm kind of nervous." Well, like once. And our guy said, "I've done it like 30 times. I can help you with it." I think the experience is what speaks to it. As well as in Arizona and at our CHC as well, we're going to have a special needs chair for kids, which is our heart as well. A lot of the patients that come to these are kids. Mom and dads bring their kids because they're impoverished and they can't afford to go, but they want their kid to have good care. So with this special needs chair, there's like 4 in the country. We have two of them, and it's a lift. You can roll the kid's wheelchair right up into the lift, and it'll lift them up. It'll tilt them back, and it does a lot of things. It provides comfort for the mom and dad, so they're not nervous. Provides comfort for the child. Provides comfort for you, because taking someone who is handicapped mentally or physically and moving them, that's a lot of stress for a third and fourth year students. So I really like that. We were debating, we were kind of petitioning, let's get that chair here, let's get it here, and we got it. We were really excited about that. Okay, I put in just some general application tips for you as you are getting ready to apply. I know someone has already got an interview with UKC, so that's good. Just a few general application tips that will go along. The first several are very generic. Mission, philosophy, success rate. I think we had 97% on our boards, first time pass rate, something like that. Look at the class size, averages, all that stuff. In-state, out-of-state. What is the acceptance ratio? We're private, so it doesn't matter. We have people from all over the country, and that apply to us. So it doesn't matter if you're from Kansas, you're from Missouri, you're from Virginia. It doesn't matter. Prerequisites, you looked at that. Timeline of application cycle. ADSAS opened June 4th of this year, in case you didn't know. And it goes, we will accept applications to our Arizona school through December. And there you go. Missouri has not yet been announced yet. It might be a little later than Arizona because of the things that we're going through. Okay, so when you're applying, this goes back to the tips. Look at all that, your prerequisites, get everything lined out. A little tip about how we work. Not every school works like this. You apply through ADSAS. It takes about 4 or 5 weeks. It takes about a month. So you're already in July. It goes to our school. We look at it. Do they meet the minimum requirements? Is everything lined out? If you do, we send you a secondary application through your email. So I get phone calls all the time. Where's your secondary application? Is it on the website? Can I see it? Like, no, it's coming through your email. So then the student gets that. They fill that out. They get back to us. It takes a couple weeks to process that. Then somebody like myself will go through and pre-screen it and see if what are the GPAs, what's the DAT, what's the community service, and things like that. As soon as we do that, which could take 2 to 3 weeks, it goes to a committee. Like, I will give my recommendation one way or the other. It'll go to a committee. The committee will decide whether or not to grant an interview. That's kind of the application process, very, very quickly. So, personal statement. I talked about 2 things. Letters of recommendation that will tell a lot about you other than the hard facts. Personal statement. Personal statements are huge. They're really important. The one thing you want to do in your personal statement is tell me why you want to be a dentist. That's your goal. When I read personal statements, I read them all the time. I'm looking for that. Why does this person want to be a doctor? Why does this person want to be a dentist? I want to see your passion for it. I want to see what your drive is, what your commitment to it is. Some people will write personal statements. I've wanted to be a dentist since I was 6, and this is why, and they list it off, and you can tell their passion is coming through. Some people say, I decided I really found I wanted to be a dentist while I was in high school or college, and this is why. I really want to make a difference in people's lives. This is really passion for me. Neither one is better than the other, but I'm looking for the passion. That's what's important. Disciplinary history is also a very important key. Never lie. Never try to cover anything up, because the schools will find out, and if you've been offered a seat, it's grounds for immediate dismissal. We understand that people are human. Okay? People make mistakes. So what we ask is people are upfront and honest with us, just like you would want from anyone. It's okay to take a little space in your personal statement, talk about that. That's fine. But we want to see how you've grown from it, how you've changed. What did you learn from that experience? Some people will have a DUI. Not saying anybody here will, but some people have a DUI, and it was like in their freshman year, and they talk about how I was stupid and everything, and I actually got involved with Mothers Against Drunk Driving and all this stuff, all these steps they take. So it shows us the commitment. It shows us the passion. Obviously, you need to be honest. You need to be genuine. Avoid jargon and slangs and acronyms. I got one that was like, I was the president of the ACMMACOL. And it's like, that doesn't mean anything to me. Spell things out. The personal statement is such a professional reflection upon you. So what the most professional reflection upon you that I see until an interview. Personal statements are really important. List all the jobs and stuff, but also share examples. If you shadowed with Dr. Brown, talk about what you learned with him. Talk about the experience. That's important. Proofreading and seeking feedback is key as well. Have your friends look at your personal statement. I think that a good personal statement takes about 4 or 5 rewrites. Have your friends look at it. Have your advisor. Most advisors will look at it as well if they're a serious advisor. Make sure that you haven't misspelled things, had punctuation problems, things like that. Build those relationships. Again, that's important. Verifying application status. Again, I talked about how it takes a couple of weeks for things to get going. It's okay to call after, if you submitted your secondary application, it's okay after like 3 weeks to give me a call and say, I've submitted my secondary application, can you kind of tell me where it's at? But it's not really going to help you to call the day after you submit. I've had people do that. Where's my application at? Well, I don't know. So I talked about this earlier. This is kind of a little later than what I used to do it, but you can see the applications. The application 1 and 2. This is very, very extreme. Don't get scared by that. But we look for that community service. Red flags, general things, weak clinical shadowing experience, passion. We want to see the passion. We want to see the community leadership. Don't make excuses for anything. Own up to it. We don't want to see somebody who's blaming the professor for a couple of C's or a D or something. We want you to own up for what you've done. Again, be sincere. Have a positive approach. Nobody wants to be around somebody who's negative. I've read personal statements where they're negative. and it doesn't. It's not a good statement. It's not a good personal statement. So be positive. Proofread is all capitalized because it's so important. Don't again make excuses. This one is big. I've got applications where this person is a good applicant, but they know they are, and they're going to let me know they are. And it's really not a good reflection upon them if they're arrogant. So be humble. We want you to talk about what you've done. You need to talk about your strengths, but do it in a humble way. Last thing, don't use it as a creative writing assignment. Okay? So you want to be professional. So don't do those. My boss got this one. And so, yeah, we stopped for a while, and she said, hey, you know, it changed up our day. But in a personal statement, you only get so many characters to use. Be professional. Make sure that it looks like it should be. And then we are on the website. You have my information. Hopefully you get a card. If you need help with anything, let me know, because that's part of my job is to give guidance and counseling. So, any questions?
I've got some questions on the applications process. Basically, my number one question is I've looked into the ATSU a little bit, but does it matter what batch you apply in? Is it earlier the better? Because that's been something I've had on my mind.
Most important thing that I will say today, apply as early as possible. The reason you want to apply early is because it's very practical. If you think about it, okay, so we have 40 seats in Missouri, right? Okay, we're interviewing this whole time. We'll probably, I think, hopefully next year or this year it's a little different because of what we're going through. But hopefully next year, around October, we'll start interviewing, and that's with the people that first apply first. So if people don't apply to like late November, early December, out of those 40 seats, how many are going to be there? Because we're offering seats to people as we're interviewing. So it's very practical. Apply as early as possible because it's more competitive because there's not as many seats. And there's still a lot of people that are applying. So apply early. Definitely.
And out of all those applications you received, I know you threw out the number over 3,000. Do a vast majority of those meet your minimum requirements, or would you say you throw out a lot because they hadn't actually looked into your school?
I don't have the hard data for that, but there are going to be a lot that don't meet the minimum requirements. And then there are going to be people who apply, and then we send secondary applications to, and then they're not competitive through that. And then there are those people who apply and we send secondary applications to, and they've already got another school lined up by the time they get our secondary application. So it's a whole range of things that can affect that. But some people don't. Some people apply and they don't. They don't really understand what it is to go through a dental graduate school.
Who does the interviews? Like, do admissions people like you do the interviews, or is it just like a one-on-one, or?
Okay. We're very fluid right now because we're so new and everything's getting established and it's going very quickly. So it's very fluid. So the short answer is I don't know exactly how it's going to go. I've actually, with my boss and I, we submitted a proposal of how we think